Let's go through some important NAVLE-style clinical cases. I'll show you the image for each case, so pay close attention to the findings and try to answer before I reveal the correct option. Starting with the first case. An 11-year-old spayed female cat is presented with generalized weakness and is unable to lift her head. The owners have noticed that she is spending more time at the water bowl and seems to be urinating more frequently over the last month. Which blood chemistry test would be most likely to diagnose the cause of her weakness? Option A, sodium. Option B, potassium. Option C, chloride. Option D, calcium. Option E, bicarbonate. Take a moment and think about the combination of generalized weakness, neck weakness, and increased drinking and urination. The correct answer is option B, potassium. This is a classic presentation of hypokalemic myopathy in a cat. Cats with low potassium levels often develop generalized muscle weakness and may show cervical ventriflexion, meaning they are unable to properly lift their head. As suggested by the history of increased thirst and urination, chronic kidney disease is a common underlying cause because potassium can be lost through the kidneys. Now ruling out the other options. Sodium abnormalities can cause neurological signs but are not classically associated with neck ventriflexion. Chloride disturbances are usually secondary to other electrolyte disorders. Calcium abnormalities can cause weakness but do not typically produce this classic presentation. Bicarbonate abnormalities reflect acid-base status and are not the primary cause here. Other differentials for generalized weakness and neck ventriflexion include polymyositis, organophosphate toxicity, and myasthenia gravis. Now moving to the second case. This cow presents with a corneal abscess secondary to infectious keratoconjunctivitis, commonly known as Pinkeye. As shown in the image, there is significant corneal involvement associated with this ocular disease. What is the most commonly recognized organism that causes Pinkeye in cattle? Option A, Moraxella bovis. Option B, Chlamydophila picorum. Option C, Mycoplasma species. Option D, Coles iota conjunctivi. Option E, Neisseria species. Take a moment and focus on the species involved. The correct answer is option A, Moraxella bovis. Moraxella bovis is the most commonly recognized cause of infectious bovine keratoconjunctivitis, or Pinkeye, in cattle. Infection can lead to conjunctivitis, corneal ulceration, corneal opacity, and in severe cases, corneal abscess formation as seen in the image. Now ruling out the other options. Chlamydophila picorum is more commonly associated with Pinkeye in sheep. Mycoplasma species can contribute to bovine Pinkeye but are not the primary recognized cause. Coles iota conjunctivi is not a recognized major cause of bovine Pinkeye. Neisseria species may occasionally be isolated but are less commonly involved. The severity of infection may increase when Moraxella bovis infection occurs together with infectious bovine rhinotracheitis or other pathogens. Now the third case. A flock of chickens from a poultry operation is presented with an outbreak that began 2 days ago with the unexpected discovery of 20 dead birds. Since then, approximately 25% of the flock has become ill. Affected birds are depressed and anorexic, with mucoid discharge from the beak, ruffled feathers, diarrhea, and increased respiratory rate. 2 birds show torticollis. Several chickens have swollen sternal bursae, wattles, joints, tendon sheaths, and footpads. What is the clinical diagnosis? Option A, infectious bronchitis. Option B, fowl cholera. Option C, infectious coryza. Option D, infectious laryngotracheitis. Option E, Newcastle disease. Pause here and correlate the acute deaths with the swelling of wattles and joints. The correct answer is option B, fowl cholera. This is a classic presentation of fowl cholera caused by Pasteurella multocida. Acute disease often presents as sudden septicemia, and the first sign may simply be finding dead birds. In chronic cases, localized infections develop, resulting in swelling of the sternal bursae, wattles, joints, tendon sheaths, and foot pads due to fibrinosuppurative inflammation. Torticollis may occur when infection extends to the meninges, middle ear, or cranial bones. Now ruling out the other options. Infectious bronchitis is associated with respiratory disease, decreased egg production, and poor egg quality. Infectious coryza typically causes acute respiratory disease with nasal discharge, sneezing, and facial swelling beneath the eyes. Infectious laryngotracheitis commonly presents with gasping, coughing, and blood-stained beaks, often with blood plugs in the trachea. Newcastle disease primarily causes respiratory signs, and severe forms may also cause neurological signs and diarrhea, but the characteristic chronic localized lesions described here strongly support fowl cholera. Now the fourth case. The following cytology sample was obtained from a bronchoalveolar lavage in a dog. As shown in the image, there are large bacteria with a distinctive ladder-like appearance. Which one of the following choices is the most likely diagnosis? Option A, actinomyces pneumonia. Option B, bacterial bronchopneumonia. Option C, fungal bronchopneumonia. Option D, eosinophilic pneumonitis. Option E, bacterial contamination. Take a moment and focus on the morphology of the organisms shown. The correct answer is option E, bacterial contamination. These organisms are Simonsiella species, bacteria that normally inhabit the pharynx and have a characteristic large, ladder-like appearance. Their presence in a bronchoalveolar lavage sample usually indicates contamination from the oropharynx during sample collection rather than true pulmonary infection. Now ruling out the other options. Actinomyces pneumonia would typically show filamentous bacteria associated with inflammation. Bacterial bronchopneumonia would usually involve bacteria located within neutrophils or macrophages. Fungal bronchopneumonia would demonstrate fungal organisms rather than these characteristic bacteria. Eosinophilic pneumonitis is characterized by eosinophilic inflammation, not pharyngeal bacterial contaminants. The key point is that bacteria become clinically significant when they are found within inflammatory cells such as neutrophils or macrophages. Now the fifth case. A 4-year-old quarter horse is presented with a 3-week history of diffuse patchy alopecia on the ventral midline and face, including a distinctive bullseye lesion in the center of the forehead. There is also mild conjunctivitis and uveitis in both eyes. A punch skin biopsy is shown in the image. What is the most appropriate treatment? Option A, ivermectin now, repeat in 4 months. Option B, trichlorophon drench with antibiotic ophthalmic ointment 3 times daily. Option C, do nothing. Option D, corticosteroids with benzimidazole piperazine every 12 weeks. Option E, topical DMSO with oxybendazole every 8 weeks. Pause here and consider the combination of dermatitis and ocular disease. The correct answer is option A, ivermectin now, repeat in 4 months. This horse is suffering from onchocerca-associated dermatitis. Adult filarial worms reside in calcified nodules within the ligamentum nuchae and produce microfilariae that migrate to the ventral midline, face, neck, and chest. The resulting skin disease is believed to be a hypersensitivity reaction to microfilarial antigens. Microfilariae can also accumulate in the eyes, resulting in conjunctivitis and uveitis. Treatment of choice is an ivermectin family drug such as ivermectin, with retreatment every 4 months. Most treated horses show significant improvement, and many become clinically normal within 6 to 12 months. Now ruling out the other options. Trichlorphon is not the treatment of choice for this condition. Doing nothing is inappropriate because this horse is symptomatic. Corticosteroids and benzimidazole piperazine combinations do not effectively address the underlying infection. Topical DMSO and oxybendazole are also not considered standard treatment. An important point to remember is that culicoid species, the biting midges known as no-see-ums, serve as vectors for onchocerca microfilariae. However, culicoids themselves more commonly cause sweet itch, a highly pruritic hypersensitivity dermatitis. Only a true veterinarian can answer this. A dog is infected with a parasite and sheds infective stages in its feces. Another dog becomes infected by ingesting contaminated food. Which combination correctly identifies the source and transmission route? Option A, source, soil route, vertical. Option B, source, dog route, fecal-oral. Option C, source, water route, blood transfusion. Option D, source, vector route, sexual contact. Option E, source, dog route, blood transfusion. Drop your answer in the comment box. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update from Vetcare.